I now would like to welcome onto the stage Star Jones, host and judge of Fox's Divorce Court from Fox Television Studios, and chair of the U.S. Commission for the Preservation of America's Heritage Abroad. And with Star Jones, please welcome Alexis McGill Johnson, President and CEO of Planned Parenthood Federation of America, for the introduction for this session. And this session is called Time to Act, Women's Health Across All Ages. Please welcome them onto the stage. Lovely to see you. Wonderful.
Hello, everyone. Oh, I didn't hear you. Hello, everyone. Hello, very much so. Nice to see you all. Very much so. We are going to take the middle, and this is a conversation that I think people are having all over the world. Alexis, so why don't we table set for just a second? How actually did you get involved in public policy?
Well, I am a political science professor by trade, and I chose political science because politics is the study of power. And policy is how we distribute resources and how we engage, mobilize people into deciding how to distribute those resources. And so my work has always at the center had, communities that I was concerned about, marginalized communities who didn't have access because of bad policies, because of bad laws. I've been an organizer, I've been a kind of cultural leader, but really at my root, understanding power is really what I am most passionate about.
Now, interestingly enough, you say understanding power. When we talk policy and power, that is truly the front burner of Planned Parenthood right this minute. You have actually been a part of Planned Parenthood's leadership for more than a decade now, right? First as board chair and a part of the Planned Parenthood Action Fund's board, but then right now you are laser focused on reproductive rights and reproductive justice as president and CEO of Planned Parenthood. We're all aware, for the first time in America, the Supreme Court overturned the constitutional right to abortion and reproductive care. Having had this conversation with you, will you update us on what the real world ramifications are of that decision?
Yeah, so let's go back to June 24th when the Dobbs decision came down. Actually, we can go back to May 2nd when the leak came out that the Dobbs decision was coming down. But even within that 6-week frame, you still held out a bit of hope that the court just wouldn't be so cruel to overturn 50 years of precedent. And especially to be sitting in Paris, in a country where you're literally talking about enshrining the right to abortion in your constitution right now, to have someone like Mary Elder on stage after, when you see countries like Ireland moving forward, Argentina moving forward, and the US just going back so radically. So what's happened over the last 5 months is immediately states, you take away the constitutional right to protect abortion, you essentially allow each state to decide what they want to do. And many states had what we call trigger laws on the books. It meant they immediately reverted back to, or quickly reverted back to near total bans. There are roughly 16 states that no longer have access to abortion, and another 2 that are in contest and we're fighting in injunctions. 1 out of 3 women of reproductive age lives in a state without access to abortion. It means people are traveling on average 400 miles one way in order to get access to care. It means
what does that look like in terms of the states? Give me so that we can fully appreciate that.
So, what do you mean, what does it look like?
Like in terms of, if you live in California, you have access to care.
Right. So you live in New York, you live in California, you live in Illinois, you find yourself pregnant and not wanting to be, You make an appointment, you go to your local Planned Parenthood, your independent provider, you get access to an abortion, and without, because you've made a decision, that is your private decision, you're able to do that. If you live in a state like Texas that has had, in effect, an abortion ban for over a year that was unconstitutional then, it means that you are leaving your job at the end of your shift. You are trying to figure out where to get childcare because most people who access abortion are already parents. It means that you are getting in a car and you are driving 11 hours one way in order to get to your appointment. It means your appointment could change because we are filing lawsuits constantly in order to open up access. So, there's a lot of uncertainty, there's a lot of chaos. The ripple effect on that, right? So that's for the patient. On the providers, right? And you're talking about women's health. I think of the currency of women's health is trust, right? Or currency of health, period, is trust. It means that doctors are now turning themselves into lawyers in order to make decisions about whether or not they can provide care. It means that patients with intended pregnancies who are coming in, but pregnancies that may be no longer viable for whatever reason, doctors can't just say, here I can give you the abortion care that you need for your miscarriage. It means they have to wait until a patient becomes septic, yes, right? Almost die before they can justify to their hospital, to their boards, to their insurers, they can give the care. So the disruption that is happening in the healthcare system, the ability to provide care for ectopic pregnancies, which are not viable for the parent or the fetus, right? Those are the kinds of things that we are seeing, the implications for things like IVF. It's extreme.
So it really and truly is women's health that is now on the front burner. It's not just reproductive care, it's the health of women and girls. Alexis, speaking of reproductive care, the phrase reproductive rights and religion are rarely in the same sentence unless they're in opposition. We've talked about that also. I know you're a person of faith, and since the Women's Forum brings together women from around the world with a variety of beliefs, how do you support the inherent morality of women's freedoms and health decisions and reconcile it with your own, and I don't mean your personally, but our own religious and faith beliefs?
Well, I mean, first I'll speak as a woman of faith, right? I think it's very, we are able to both hold our own personal values, our personal relationship with God, as well as believe that government should not be in the middle of making decisions for me, absolutely, right? There's no room for a lawmaker in the exam room, and there is no room for a politician in my prayer book. That is how...
Reconcile it by keeping it separate and distinct.
Exactly, church and state, thank you.
Makes complete sense. That's not the only issue. As you and I know, there have been recent attacks on American society, or I should say in American society, on just women making our own personal decisions, period. Not just about abortion, but what about contraception and family planning, who to marry, and how you're going to express your intimacy is a big deal. What's going on with the American who is supposed to be the shining city on the hill where everybody's supposed to get their example of?
I mean, again, here we are. We always talked about American exceptionalism in democracy. American democracy is under assault. And I don't say that lightly, being in Europe and countries where, where we understand what tyranny looks like in a very real way. We understand what authoritarianism, and U.S. has always been held up as an example with the checks and balances to prevent that from happening. But when you assault reproductive freedom, oftentimes in authoritarian governments, it is one of the first things, attacks on women, or one of the first kind of policies, to go back to policy habits, that happen by authoritarian, autocratic rulers, right? Essentially controlling and limiting the freedoms of half of the population. And so I don't think it is an accident that the closing argument for the US midterm elections was about abortion and about democracy, because it was about essentially abortion almost saving democracy, right? It was understanding that when you control people's freedoms, you control their voices, you take away their rights. In Texas, SB 8 was the law that everybody heard about, banning abortion. SB 1 was restricting voting rights. So they are intertwined not only in how we should understand what's happening in the US right now, but also the deliberate strategy to control both democracy, or to control democracy, and to build power by taking away freedoms from others.
And that brings you back to your policy and power. We don't have enough time to do all of what I want to talk about, but the one thing that we can all agree on, race, diversity, women's health, they're all front burner topics right now. We've been talking for a while. How do we are looking for action. How do we move it from conversation to action?
So I know I'll be quick on this, but actually I'm glad to end on this because this is about hope, right? I feel like, I have to be a bit of a hope dealer right now because what's happening across the country or across the US many parts of the world is so challenging. So I believe that when you center equity in your decision, we talk a lot about equity, but when you truly bake it into the center of your work, the ripple effect that happens will transform an organization. This year, Planned Parenthood and its affiliates received a $275 million grant from McKinsey Scott. I've earmarked our portion of that for a Black Health Equity Initiative. And the reason I did that was because we understand where the disparate impact is on Black women's health. Many of these states that are banning abortion also have the highest maternal mortality rate. So it is both challenging to be pregnant, life and death to be threatened, to be pregnant, as well as getting out of state to get access to an abortion. So really investing in communities, not as like a nice to have, but to say that the way through this as we fight state by state is to also invest deeply in the communities that are most affected. And by doing that, remaking the organization as one that actually can create healthcare for all. That is actually, I think, what the beacon is on the work that we need to do. And I think for folks who are thinking about how to engage, thinking about how to support that kind of work, I think, is as important as supporting, or abortion funds and helping people get access to care.
Focusing our attention on where people have the most need, meeting people where they are. Absolutely. Thank you so very much.
Thank you.
Ladies and gentlemen, Alexis McGill Johnson. I can listen to Alexis all day, but in reality, being able to put some of the things she says into place is really what will move the needle forward. And so let's put some of those things into place right now. It is my pleasure to introduce women who will continue this discussion on women's health across the ages. Please allow me to introduce my panel. Nupur Kohli, the director of the NIIS Health and a Women's Forum Rising Talent. Catherine DeVoe, Managing Director, Public Sector, Standard Chartered Bank. And Ghada Hatem, Dr. Ghada Hatem, Les Maison des femmes de Saint-Denis. Welcome. My French is horrible, but my heart is pure. How's that? Ladies, thank you so very much. I'd love us to continue the conversation and table set a bit for our audience today. Ghada, Nupur, I'm actually going to start with you. We've been talking about women. Let's put women and girls into the conversation. Given your role with UNICEF and the World Economic Forum, you've really made girls and young women your front burner concern. So table set for us. What do you consider to be the most pressing health issues for young women and girls right now?
Thank you so much for this interesting question, Star. First of all, it all starts from birth. So when girls are being born, what type of future do we foresee for them? And girls become women. And I will point out 3 issues that are, according to me, very important. Also what I have seen in my work as pediatrician, where I spoke to a lot of teenage girls. The first is period poverty. It's a very underestimated topic that when we talk to teenage girls, are they understanding what is happening within their bodies? Are there girls around the world who have even enough money to take care of their periods? And the answer is no. In many countries around the world, even in many countries that we consider modern, that is not the case. And when that's not the case, there can be infections and other diseases as a result. The second one is, during the pandemic, anxiety and depression increased majorly. The gender health gap has increased. We underestimate how important it is if we want to have women who can be foundations of our society to also take care of their mental health, especially anxiety and depression. And the third one is malnutrition. We should not underestimate that at many countries around the world, girls are still not getting the same food or nutritious food as boys do. And I believe, according to all other topics that are already there, we should not forget these 3.
And listening to you, those are just very basic needs. These are not things that would be considered extravagant. These are human needs.
And that is actually why it's so urgent that we pay attention to this and also lobby with our governments, especially young women who are sitting here in this audience. It's our task to talk to our governments, to decision makers, that because these are basic needs, we need to make a change.
And Catherine, to continue what Nupur has laid out for us, she said speak to governments, but I say also speak to public and private sector entities. So how does a bank like Standard Chartered look at women's health in the workplace, and why have you actually chosen to specifically focus on menopause? Nupur's talked about young women and girls. You've taken it to the next stage, a stage that I am a member of. So if I start fanning, understand exactly what that is happening. Bringing in the private sector, talk to us about your role.
Thank you, Star. Well, Standard Chartered, as you said, is a bank, and we take women's health seriously. Just in a nutshell, we are in 59 countries. Our workforce is 84,000 people, and we have 131 nationalities. And women's health is under the umbrella of well-being, including mental well-being, physical well-being, social well-being, and also financial well-being. All that being under the umbrella of D&I. And the D&I strategy, which was designed in 2018, is implemented both by all the businesses, by the countries, and by HR. So what we do at Standard Chartered is that we try to offer a portfolio of well-being resources to all employees. And this portfolio includes apps, includes support, both from internal sources, but also from external sources, includes the way we design our offices. So in Paris, for instance, we have a mother's room where the woman coming back from maternity leave can just, and who are still breastfeeding, can just, rest and, do what they have to do when they have milk. And also in other places, you may have gym, you may have prayer rooms, or you may have meditation room and restrooms. Now, to answer your question, Stars, and why is it we embarked on the menopause campaign? It started a few years back, and Standard Chartered commissioned a study together with the Financial Services Skills Commission in the UK, to study the impact of menopause on the workforce. And we realized that 1 in 10 women currently working in the UK in the financial services industry was impacted by menopause. And basically, it was around 130,000 women were impacted at a certain time. And we realized that this was totally taboo, both in advanced economies like ours, where menopause was associated with age, but also in emerging markets. And the idea was that, based on the outcome of the study, of the research, which was published in October 2021, we embarked on a campaign which is currently in pilot stage in 5 countries, in India, in Hong Kong, Singapore, in the UK, and another country which will come back to me. So basically in 5 pilot countries who are piloting the experience. And what is it we do? We allow, first of all, time for the women who want to rest. We allow also flexible hours, but more essentially, we engage the conversation and we normalize the conversation. We have produced toolkits, not only for every people working at Standard Chartered, but also for the people leaders, so that they can be empathic, and they can also understand what the ladies are feeling when they have menopause. And the reason why we embarked on that is basically to make everyone feel included and to retain talent at every age, regardless of, you know, whether this is still a taboo, but hoping that in the years to come, it won't be any longer taboo to speak about menopause.
We want to be able to participate in society in all life cycles, from girls and young women through adulthood. And yet, Ghada, as a medical doctor trained in gynecology and obstetrics, you see women at all phases of our lives. You've seen some of the manifestation, however, when women's health is not put on the front burner, and you have decided to make your life's work involved in gender-based violence as it relates to women's health. Draw that connection for us.
Thank you. First of all, Catherine, I think that menopause is the beginning of a second life, and it's not such a bad period.
I agree.
You are free again, no kids.
Yeah. You won't die, just wear short sleeves. What's the big deal?
But let's come back to violence. Of course, during all my practice with women, I noticed that whatever your social level, your education is, you can face violence. And this is, I think, the ultimate taboo. Because when you're poor, you can maybe talk about it. When you're rich, you can't talk to anyone because we don't believe you. You seem to have such a very nice life, and it's impossible to imagine what's under the door when you come back home. So I decided to build this structure called the Maison des femmes, and it's built on the notion that violence against women is a public matter, a public health matter. This is why I felt the need to go into this direction. And we, as doctors, we cannot properly diagnose women if we don't get a history of their abuse. Our model, this special Maison des femmes, comes from a very simple rationale. Women who have suffered traumatic episodes in the past or present may not go to police station. They may not seek legal help. They may not be able to afford therapy. They might be too shy to go to a dedicated non-profit organization, but they will eventually seek some form of medical care, whatever it may be. We believe that it's when they seek that medical care that doctors have a responsibility to diagnose their trauma history in order to better understand their health status. If you ask a patient whether they smoke or drink, it's because it has an impact on her health. We now know that if they have been a victim like incest, maybe 50 years ago, it also impacts their health. Therefore, we must know.
And to incorporate the whole woman into the history from a physician's point of view. If you don't know the full history of your patient, how can you ever treat that patient? I completely understand. We've all sort of touched on conversations that are supposed to be taboo, or I should say topics that are supposed to be taboo. When I was a prosecutor in New York, I can't tell you the number of women who were victims of domestic violence in every single social strata, from the very wealthy to the very poor. Every woman at some point is going to go through the life cycle. And we all understand what it's like to enter into adulthood or womanhood with menstruation. We don't discuss these conversations. So that begs the question, why are we still so uncomfortable about our own health needs? What we need, what we want, what we deserve. Nupur, why don't you start?
Well, I think there are a few factors here at play before I talk about being uncomfortable. First of all, do we women know what are our rights to health? I think that's maybe also the first conversation we should be having. Do we know what health or healthcare are within our own rights? I believe that when we address that and also educate women on that, they will also stand stronger within their own shoes. Then also, why do they feel uncomfortable? I am a medical doctor and I know how our training goes. We do not always learn that we need to have empathy or understanding for certain problems that women come with to us. It definitely starts with that part, because only when you have understanding and empathy and your patient feels that as well, then you can take the next step. And the third part for me would definitely be society, and also the other gender, our male counterparts, to make it more comfortable for us to talk about what we are going through. And we do that together as a society, and take that taboo away. And we have to do that together.
Okay, Ghada, I'll ask you to pick up on that, because you're definitely introducing something that people don't want to talk about. It's quiet. And when it comes to a woman's own health needs, we often feel invisible. Why is that?
Well, it's difficult to answer this question. I think, first of all, we're educated to take care of others, yes, and our personal needs come later, if we have time for that, if we still have money for that.
Yes.
It's like eating, like food. Food is first for boys, and then if there is something spare, you can eat it. So I think
we're not lions. That's what the lions do. They feed the boys first, okay?
I think we should change this model, and understanding that women are so important today and so powerful. Things are changing, so we have to ask governments to recognize the public health impact of whatever we go through our lives, and to make some special money, comment on dit, des funds dedicated to these specific topics of our health.
And interestingly enough, I serve as national volunteer for the American Heart Association, and I tell the story that women literally will be writhing on the floor with chest pains of a heart attack and not call 911 because we didn't clean the kitchen and we don't want the ambulance to come to see that the kitchen is clean. But we will literally take care, make sure our child gets to the pediatrician if there's a runny nose. So women do have to put ourselves on the front burner. I'll ask you, Catherine, it's fair to say that the health systems are just not set up for women to succeed. They're not designed to meet women's day-to-day needs. What do we need to do to change that system? We now have discussed what the problems are. What do we need to do to fix it?
Maybe allow me start just to make one comment on the systems.
Yes.
And just to say that if you compare where we sit in advanced economies, in France, for instance, where the social security sends you regular invitation for checkups, for preventive x-rays to avoid, breast cancer. And where a lot of other women sit in low-income economies, where 70% of the population lives under $1 a day, and 80% of the population have no social health cover. I think that there is a wide gap between, in fact, in women's condition versus their health. And in a way, we are privileged if we compare it with the rest of the world. So how should we make sure that everyone has access to a minimum of health care? We saw one very nice example in Kenya, for instance. Standard Chartered Finance supports a foundation called Future Makers. And in Kenya, the young entrepreneur basically took care to the home of the people, instead of them coming to the hospital, which was basically ruining the finances and also the family, because then she basically carried the care at home. So those examples are ways in which we need to rethink the way we deliver healthcare to women. And also, probably it comes from us in the first place, in those advanced economies. We have to make sure we put our health, front and center, even out of love for our family. Because if we disappear, then it won't help them. So it's both a change in mentality and also not fearing of looking weak in the corporate world. That's what you try to avoid. You don't want to look vulnerable, so you don't talk about your health issues.
You also you need the system to think outside of the box, not to just do what has been done, but to look for ways to improve what is being done. Nupur, what would you add?
Well, we did not talk about technology yet. Another thing that's very important that we, if there are entrepreneurs in the room, we should also address is that still many of the technologies that are being developed, the general technologies for healthcare, are not always equally tested for women as well as for men. So I believe we should, that as well as a society, as well as an entrepreneurial community, change as well. And definitely also look at how we can use technologies in more rural parts of the world where we want to give women more access to healthcare. To give an example, sonography for women when they're pregnant in rural areas is so important. It's just a simple technology, but we should work all together to also spread that in certain parts where that's not there. When we're talking about breast cancer screening or cervical cancer screening, technologies of which I believe all women should have access to. We live in a modern world, so that's something we need to change, also together with the private sector especially.
And to continue on that, Ghada, I'm thinking we have to embrace a culture of change in order to put new systems in place and improve the systems that are in place. So what are your opinions on how we actually do that? We have women from around the world joining us this week at the Women's Forum. How do we embrace that culture of change?
Well, I'm just poor on some doctors, so I'm not sure I can answer your question. I think we should take care of kids first.
Yeah.
This is where the change must come. About education, about sexual education, emotions, consent. And in France, we have a great law that we should go at schools and college 3 times a year to reach all the students every year, and we don't do it. I think it's a very interesting way to make change in the society.
Is to start with younger children, boys and girls. Nupur, I can imagine that that is something that you preach constantly, that it will start with the younger generation.
I do, and to really shortly react, I'm a board member for UNICEF in the Netherlands. We have a youth panel with young girls on it as well, and we do our best to involve them. Also, what Catherine has been saying, Ghada has been saying, involving women to have ownership of their own health and healthcare, to me is the core.
Yes, and Catherine, culture of change. How do we do that in the private sector, which is where your expertise is?
Well, culture of change is it's a continuous effort, and basically it's a push to put people outside of the zone of confidence, of comfort, and you do that by taking stands. And the menopause is one example. You sign the menopause chart and you show to the whole financial services industry that you have to move and you have to stop thinking the way you were thinking ages ago. So it takes step by step, but also it takes people. Every one person needs to change.
And I also think leading from the top, whenever there's an organization, when the leadership in that organization says this is going to be the cultural change, that becomes the cultural change. It's extremely important to get buy-in from the leadership of whatever organization. Finally, in our last few minutes, I'm going to give you each 1 minute. You get to wave your magic wand across this entire audience and give them one key takeaway or action item when it comes to the health needs of women at every moment in our lives. How do we put ourselves first? Or put our own mask on before we try to help others? Nupur, you start.
I will stick to the word involvement. Whether you're a developer, regulator, or a healthcare professional, involve the people it's actually about, and that's the women.
I think you stole Ghada's word.
Sorry, Ghada.
Ghada, I'll give you a minute to think now. Catherine.
Well, I would like to say that even strong ladies need to take care of their own health.
Yes.
I will also talk about men. Today, suicide is the first cause of death after delivery. So I think we should involve men in the postnatal care so women can feel discharged from this huge emotional moment, and I think it will lower the suicide level, taux de suicide.
Yes. And then finally, I would add hope. I think when it comes to health, what we're all looking for is hope that there will be new technology, continued involvement, strength of community, and community that will move the health needs of women to the front burner, not just of conversation, but of action. I believe very strongly she who has her health has her hope. And when you have your hope, you have everything you need. Thank you so very much. Please thank the ladies.
Thank you so much, ladies. Thank you to all of you. It's been a fantastic discussion.